Welcome back. This is part 4 of what is Hashimoto's thyroiditis. This is a very important topic. I see a lot of patients in my practice that this has gone undiagnosed for way too long, okay? So I'm going to just summarize it again that Hashimoto's thyroiditis is a condition where the thyroid itself is functioning fine, but the immune system is attacking it, okay? And the way we figure this out is that we check a blood test called TPO, thyroid peroxidase antibody, or sometimes we also check a second antibody called anti-thyroglobulin antibodies, okay? If any of these two antibody levels are high, then we diagnose this condition, especially in the setting of a patient having all kinds of symptoms like fatigue, losing their hair, poor sleep, constipation, they're experiencing mood swings, they're feeling like brain fog, anxiety, palpitations, panic attacks, spontaneous abortions, they can't get pregnant, infertility. The list goes on. Thyroid affects so many things. We believe it's over 200 functions in the body that the thyroid has a role in. Okay? So when we have that many things that this whole gland, this thyroid gland can affect, we definitely don't want to miss diagnosing this condition. Okay? So now, how prevalent is it? Well, we've talked about the fact that 1 in 8 women are likely to have thyroid disease, but specifically Hashimoto's thyroiditis, we find that it's more common in women than men. We have almost a 10 to 1 ratio where women are 10 times more likely to have this condition than men. We also see that it can be found in patients within the age of 30 to 50, which is usually where we tend to diagnose it, but it can be seen at any age, especially because it runs in families. So genetically, we found that there is a HLA-DR set of genes that you can inherit from your family, especially on the mother side of the family, that causes you to develop or to be at a higher risk of developing. This is also very common in patients that have other autoimmune diseases. What do I mean? Yes, when someone has one autoimmune disease, the statistics is that in your lifespan, there's a chance that you might develop 2 or 3 other autoimmune diseases. So when we see one autoimmune disease, immediately we have to start screening you for other autoimmune diseases because we know they run together. Why is that? Well, because the immune system, once it starts attacking, well, it's not just going to attack the thyroid, right? It's going to attack other things. It can attack your pancreas and cause type 1 diabetes. It can attack your joints and cause rheumatoid arthritis, right? It might attack your gut and start causing celiac, right? It might attack, different things, your kidneys, and we start seeing lupus, your lungs. So it goes on and on, right? So we have to start screening for patients. Whenever we see one autoimmune disease, we look for other autoimmune diseases, right? So that said, the other thing we have to think about is with Hashimoto's, what are the triggers? Which patients are we more likely to find autoimmune disease Hashimoto's in? Those are patients that have a history of viral infections, for example. So if you've had mononucleosis when you were younger, right? Epstein-Barr virus is the cause of that, right? So we know that patients that have this infection at some point in their life are at more risk of developing this condition. We've also seen it in patients with the herpes family of viruses, right? HSV1, HSV2, we've seen HSV8, and so on. We also see it in patients that were infected with rubella, right? So we have vaccines against this now, but back then, if you've been exposed and you were not vaccinated, you are definitely at risk. We've seen this with Coxsackie virus. We've seen it with also the virus called HTLV1. And there's some studies now suggesting that it might also be seen in patients with cytomegalovirus, or what we call CMV. So these are just a few viruses that we have linked with autoimmune disease such as Hashimoto's. What are the other causes or other triggers, environmental factors that we've seen? Patients with exposure to radiation, right? If you lived in a place where you were very close to a radioactive plant, you might have been exposed, and for that reason, you're more likely to develop Hashimoto's. We've seen it in patients that have been exposed to excess iodine, right? Is your diet where you live very high in iodine, right? Lots of seaweed, lots of kelp, lots of sushi maybe. So there's a lot of iodine in that diet. People that eat a lot of seafood also have to be mindful of this. Or do you put excessive salt on your food? Because a lot of salt is now iodized, right? So you might be overexposing yourself by using that table shaker, okay? We also talk about heavy metals. Where would I be exposed to heavy metals? Well, people that eat a lot of seafood, because you're eating especially the bigger fish like the sharks and things like that, they will have more heavy metals. We see that in tuna, right? I mean, even your salmon nowadays is not safe, right? So you have to be mindful of that. And we also see heavy metals in patients that have had silver fillings in their mouth, right? So you have some decay, some cavities, and the dentist puts this silver fillings in your mouth. Well, they're not made of silver, unfortunately. Most of them contain mercury. So that could be a problem. We also see it in smokers. Smokers are exposed to a high amount of cadmium. Okay, cadmium is a heavy metal, right? We get that from cigarette smoke. So if you're a smoker, you're continuously being exposed secondhand to cigarette smoke, you could be triggering autoimmune disease, Hashimoto's, by just being exposed. We know patients that are highly stressed, right? High stress level, what causes high cortisol? What does high cortisol do? Dysfunction of your immune system, right? So we know high stress is definitely a trigger for autoimmune disease and specifically Hashimoto's. Lastly, I will also touch on the fact that we see this in patients on medications like amiodarone, which we use to treat heart conditions, right? Irregular heartbeats. We see it in patients that are treated for bipolar disorder using, high doses of lithium. We also see this in interferon alpha. This is I call it like a chemotherapy medication that we use to treat, cancers and certain viruses. So those are areas where we can see the medications that we're taking actually triggering an autoimmune problem that then causes our thyroid not to work properly. So as you can see, Hashimoto's is very prevalent because there's so many sources or triggers that can cause it. You've got the genetic factor, you've got the virus factor, you've got the stress factor, you've got the age factor, you've got the sex factor. I mean, there's so many things that can cause it. And for that reason, this is something that we need to be routinely screening for, or at least every now and then asking our doctor to check and make sure we don't have this disease, especially if you have any of those symptoms that I mentioned earlier. So if this has been helpful, please make a comment in the section below. Share this video with someone that might need it. Don't forget to join our free VIP group where we go into more details on how we take care of problems like this holistically. I'll see you on the next one.